Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thanks for tuning in. I'm glad to be here. Today, we're going to continue on a dialogue we've been having, or a series, on self-silencing in women and the impact that it has on your health. In practicing medicine all of these years, the thing you see in cases around me, what you think you're supposed to see as a physician, you're always supposed to look for patterns. In that sense, I want to be more than just what's the bare minimum to do in this person to get them out of the door. And that's medicine. That's true medicine. I thought about it like this. The idea of a Disneyland dad. You ever hear that? Disneyland dad? There's a Disneyland dad. It's sometimes when a couple separates, you have the dad who's, when the kids go to the dad's just like, let's go to Disney, or let's go out to eat, or this is a Disneyland dad. The dad does all the cool stuff, but dad doesn't do the hard work. A lot of times I see medicine through that lens as well. You have a doctor who comes in and they're like the Disneyland doctor. They just give you the pills and you're on your way. It's like, I have this condition. Take these pills, you'll be fine. Don't mind the side effects. But they never do the hard work or the heavy lifting that goes behind that. Let me give you an example here. If someone comes in my clinic with autoimmunity, it's very easy to prescribe one of those medications associated with it. It's not all that difficult, to be honest with them. It's just algorithms at the end of the day and what insurance covers. That's how these doctors operate. But when it comes to autoimmunity, which I really want to get into today, there's so many more things we should be doing. It's like parenting, in a sense of like, you want to be the fun parent. Like, here's the thing that'll be fun. This is the thing here. It'll make you feel good. But you also want to do deeper work. So how is that similar to being a physician? Well, if a patient comes in with autoimmunity, I want to understand all the other aspects of their health that may be contributing to it. And that's not always a comfortable conversation, but I'm going to have it. What's your diet like? What's your stress levels like? What's your self-care like? What's your home life like? These are all essential things to understanding the person in front of me. Because by understanding those things, I'm able to apply better care. And when I apply care to someone, I always, always, always run labs verifying the effectiveness of what I did. It's the difference between subjective and objective data points. It's something big in medicine. Subjective is what the individual's observations are, the patient's feelings, what there are. And objective is what I can measure, right? So subjective, objective, it's like, that a patient comes in and they have, say, autoimmunity, and I come to terms like, maybe we should be working on diet here. I'm going to look through my lab work. I'm going to look through objective data points, such as lab work in this case, that are going to give me markers that show me inflammation. And I'm going to look for things that show me that her diet might be off. And I'm going to recommend a diet, and then I'm going to return back to that case and verify that it impacted those aspects of the labs. And therefore, I'm able to give her objective proof there was effectiveness. Now, if that helps her subjectively, how she feels, even better. With that said, sometimes I'm going to recommend things that will objectively help the patient, but they won't quite feel it yet. Some stuff takes time for it to work. Still, where I'm going with this is that I want to give you something better than what you have. And there's something else out there. Otherwise, you wouldn't be here. You would have not made it past this point in the video. You would have kicked out by now. So if you're still here, chances are I'm talking about something that you're supposed to be getting. And that's care, like true care, deep care, honest care, caring care. So when a patient presents to my clinic with autoimmunity, that's what we give them. And that's what we're going to talk about today. So when we deal with autoimmunity, a patient presents to my clinic, I want you to know, rarely if ever is it something as simple as your body one day woke up and decided, I'm done with this. I'm going to start attacking my own thyroid. There's always other factors at play. So what is autoimmunity? For those of you who've never had it and those of you who've not experienced it, some of you may have found this because you're looking up, silencing the self and the research around that, and you understand how it affects health. I'll get to that part in a minute. Autoimmunity is when your body in its process. So your cells, your immune cells are always out there and they're looking to verify that everything it sees is a part of you. It's looking for self. So your immune cells are always just kind of rolling across your cells and it's looking to see, is this part of me? And they touch the cells and they make sure everything belongs. There's markers on the surface of every cell verifying that that cell belongs, that that's a part of the body it's supposed to be there. That's part of the immune system's job. Now, in that microclimate, that little space where the cells are connecting to check the immune thing, there's going to be a lot of other factors involved here. There's going to be other chemicals. It's not just the receptors that indicate self. There's other things too. There's all the hormones. There's cytokines, inflammatory chemicals, anti-inflammatory compounds. There's all these different things exist in there. And this is where the mistake starts to happen. If that immune cell crossing across that cell of self, it makes the mistake and think it doesn't belong. There's a lot of reasons. It could be, again, high levels of inflammation, hormone imbalances. It could be contributed to genetic. There's a lot of aspects, and we're going to talk a lot about emotional stuff today too, that contributes to this. When those cells come across it and make that mistake, then your immune system says, oh, this doesn't belong here. And now it creates an immune response against that tissue. Sometimes it will be against your own thyroid gland. So that's when you see autoimmune thyroiditis. Sometimes it's going to be against other aspects of your body, like it'll be against your own DNA. Sometimes it'll be against your own mixed connective tissue disorder. Your connective tissue, your body will target that. Anything in your body, your immune system, like, yeah, I don't like that. And it'll start to go after that. It's a possibility. So autoimmunity can be a broad thing and it affect a lot of aspects of your health. MS, lupus, rheumatoid arthritis, Sjogren's, all these things is when the body makes that mistake. And once it makes the mistake, if it's a great enough verification that, oh, this doesn't belong here, it shares that memory throughout the immune system. And now the whole immune system decides we're going to go after this part of the body. This is kind of a basic concept of what autoimmunity is. It's a mistake where the body thinks that it misrepresents or misunderstands a part of you. What is silencing the self, and how does it play into this? When I started this series, I saw a lot of comments that were understanding of silencing the self, and then there's some comments that weren't. There's some people out there that don't believe that women self-silence. I don't know how to respond to that because I see it every day in my practice. I see it in my culture, and I see it, all around me. Silencing the self is a concept that was put forward by Dana Jack in the 1990s. I remember reading her book, and it was really pivotal for me. It moved me. There's 4 aspects of it I want to point out. The first one is externalized self-perception, meaning you look at yourself through the lens of how other people see you. You judge yourself based upon how other people will perceive you. You're not behaving now according to how you feel. You now behave according to how you think people perceive you. This is a very stressful thing. Very stressful thing. It's an inhibition of authentic self. And it's a suppression of self when that happens. And then it's also going to be very hard the way we judge ourselves through that lens. And you see that with people thinking that I'm not thin enough, I'm not pretty enough, I don't have the right clothes, I don't sound right, I don't walk right. All these inner critiques we give ourselves, these harsh prompts we give ourselves when we're not living up to the standard that we believe other people are holding us to. Not a good enough mom, not a good enough wife. The people see me as a good mom, see me as a good wife, see me as a good person. So we now behave based upon something that's outside of us that we don't even, that's not even all that accurate or even remotely healthy. The second one, and this is a common one, is we use care. We view care as self-sacrifice, and that the only true way to show that I care for someone is by sacrificing myself. That I see in clinic constantly, where a patient will set themselves aside. There's never time for them. They're the classic patient who is, that does the dishes, raises the kids, does the laundry, works at a job, runs the house. They they do everything for everyone else. And when I sit down and say, what are you doing for self-care? How are you take care of yourself? And they're like, I don't have time for that business. Now, there'll be some out there that are going to invalidate me right now by saying that this is garbage science, Brendan. And that's not true. That is just not true. It just isn't. When you hold yourself to a standard that is not consistent with who you are, you don't really know who you are anymore. You don't know what makes you happy. It's that externalized, identity where you see yourself only how other people would see you. That's absolutely not healthy. Pretending to be something you're not. Trying to judge yourself through what you think other people would think of you. No, that has never been a healthy thing. The other one was the self-sacrifice. You don't have to show someone you love them by hurting yourself. That's horrible. I mean, sure, there are stories of like the person, there's a self-sacrifice and there's a hero, someone who gave over their lives to save a baby out of a fire. Okay, that's self-sacrifice, But does that mean every single day that you get your kids breakfast and put the breakfast on the table, and then when they're finished, instead of you eating your breakfast, you eat their leftover cereal? Some people may laugh, but if you're a parent, you know exactly what I'm talking about. I had to learn this lesson too. I can't tell you how many times I ate half-finished bowls of cereal over the sink and without sitting down and giving myself a normal breakfast and self-care. I didn't have time to rest. I didn't have time to sleep. And I co-parent with my wife very closely. We're married, we're together, but I like to make sure I'm being very present in my marriage with my children and help in dishes and cooking and cleaning. I do all that stuff. And I do outside work too. I'm able to do a lot. But I had to learn how to be able to do those things, but also make sure I'm getting enough sleep. I'm getting enough time with my friends, with my spouse. I'm having recreational time with my family. Because it's not healthy otherwise. The research is very clear on that and obvious. I mean, come on, we all know this by now. So these are important things. The third one truly is silencing the self. And it's just the idea where you believe you should not argue at all, because if you do, your significant other will leave you. You will be abandoned. It's a silencing the self because you feel unwelcome in your own relationship. It's a little bit different from the first one. The first one is you feel like you're inadequate. You have to perform a certain way. You have to behave a certain way for this. The other one is like, if I argue or speak or be present or stand up for myself, I will be abandoned. It's a little bit different, slight difference, but it is important to note that. And this is where that person will go along with the crowd. They will do what everyone tells them to do because they want to be agreeable. They never speak up. They never say, I don't feel like eating that, or I don't feel like going out there, or I don't want to do this. They just say, okay, because they believe that if they were to ever have a different opinion, they would be abandoned. Do you see how these feel? The fourth one is the divided self, and this is where it gets weird too. It's all weird. But divided self is like you look good out front. You're trying to make sure you're doing everything right out front. You're showing yourself as being the self-sacrificing mom. You're showing yourself as being the ideal wife. You're doing everything to make sure you look good for the neighborhood, and you're showing that you're self-sacrificing. You do all those things here for yourself, so you're sure you're doing that to your children. You're virtue signaling to your husband by not arguing and not standing up for yourself at work, and going along with doing whatever people want. Like, I don't like eating fish, but you're going to eat fish anyway today because that's what we ordered. This is like, but you never say you don't like eating fish. These are all things, but the final one is just where you put on this happy face no matter what. Because angry you is not welcome. So you have this face where you're like, I'm going to look good here, but I'm angry back here. And you have this whole other life happening in the background. And that's a divided self. These are 4 things. Researched by, plenty of different psychiatrists and published extensively on the silencing the self. So when a patient comes into my clinic and they present with autoimmunity, I'll see their antibodies being high. Again, And even, I'm a naturopathic medical doctor. That's what I am, by the way. And I tell it every once in a while on a video. I'll put it out there, make sure you know this. But this is let me circle back on this. As a naturopathic medical doctor in the state of Arizona, I have a 4-year degree program. It's a doctorate. I had a master's degree going into it, so I have a master's degree and a doctorate now. And the doctorate in the state of Arizona I'm licensed in the state of Arizona to perform surgery. I do minor surgery in house. I do prescribe controlled substances. I prescribe drugs, of course. I'm capable of doing that. But the philosophy of what drives me always is lifestyle, first and foremost. How can I improve the quality of this person's lifestyle that will mitigate risk factors for the disease state that they're experiencing, but also reduce risks for future disease? So when a patient comes to see me as just a flat out old-fashioned naturopath, I'm going to, first sit there and be like, okay, what natural things, what good, healthy things can I do to modulate symptoms? How can I get antibodies down? Do I need to prescribe? Can I get away with using something a little bit less? What can I do that's going to meet where they need, get effect on the lab work, get effect on their quality of life, prove that I'm getting benefit, and at the same time, doing the most healthy way possible? That's a naturopathic way. This, what I'm talking about here, is a little more nuanced than that. I'm going to pull a little bit more out of that because I believe it is consistent with my philosophy as a physician, as a naturopathic medical doctor, is that what other things could be contributing to this? So when my patient presents to clinic with autoimmunity, I run cortisol panels on them. I run inflammatory cytokines on their panel. I listen to them. I talk to them. I get a deep understanding of their history. Because this patient will present to clinic and say they come to see me, again, we'll pick on thyroid, I'm treating their Hashimoto's thyroiditis. They've already seen their other doctor. The doctor's done the prescription maybe. What can I do better? I can sit down, I can listen to them. And I can take that time, not be the Disneyland doctor, but the real doctor that's going to sit down and ask the uncomfortable questions. Understand their history of trauma. Women experience PTSD at rates much higher than men do. Much higher. That's a cultural thing. I know that. But also, women respond to trauma much more intensely, biologically, than men do. That is a fact. When a woman is under stress, there's a greater impact to her body. Further, women's bodies, the immune system is a little different. Because they have two X chromosomes, they're going to have a little bit of their body has a little bit of a different immune approach. I'm trying to get too nerdy on this. I'm trying to, because I know when I get too nerdy, I tend to lose people. So I want to keep this at a level where it's nice conversational. So I'm picking my words very carefully. Estrogen, that X chromosome, is something called chimerism. These are things where women have these aspects of their bodies. They're more easy for them to go into autoimmunity because of this. Women are already predisposed to having autoimmunity. Women tend to have PTSD at much higher rates than men for the reasons I mentioned. How does that come together? Women tend to be more inclined towards autoimmunity. And then culturally, women are kind of pushed into this silencing the self model as well. That's a cultural thing. Many of us have been raised this way. Not all, but many, many, many women. This is a recipe for autoimmunity. If I just treated the thyroid or whatever it was, the lupus, the RA, the mixed connective tissue, any of these things, I treat them just by themselves like that, and I don't treat this, I'm missing the center point of the individual and how to be a better doctor for them. When you're under severe stress, say in PTSD, your body is more primed towards inflammation. You're going to increase the release of inflammatory cytokines, chemicals, compounds that are inflammatory. They'll be in higher rates in circulation. So when your cells of self and your immune cells cross each other, there's more inflammatory cytokines in that space. That's one trigger possibility. Further, estrogen dominance, too much estrogen, not well-balanced hormones, further does that. That creates another part of the microenvironment that's going to create a higher risk for autoimmunity as they crawl across. So inflammation and estrogen do that. That progression of stress in a woman's life as it builds up, it affects something called vagal tone. And that's the sympathetic parasympathetic part of your health. The sympathetic is the fight or flight, and parasympathetic is digest and rest, you know? And so it resets you and pushes you more into the fight or flight, more sympathetic. And it pulls you away from being parasympathetic, more or less relaxed. The problem with that is that when you're primed at the vagus that way, you're losing another pathway of anti-inflammatory that comes from parasympathetic. This is important. I'm going to come back to this vagal tone a little bit because this is part of the therapeutic approach I have with you. But this is what causes that building forward of these patients. You see the inflammation from being in a state of stress. You have the estrogen. You have the lack of parasympathetic induced nicotinic. There's a type of cholinergic anti-inflammatory pathway that your parasympathetic, this is getting too nerdy again, sorry, but that's the anti-inflammatory thing because you're not relaxing. We know, again, back to that patient, like if you're doing self-care, not sacrificing yourself to care, but you're taking care of yourself as you take care of others in a healthy way, that parasympathetic state is anti-inflammatory in nature. So when you don't do self-care, you're going to miss that anti-inflammatory component of your own biology there to try and take care of you. What else? When we're stressed, what do? I know me, I eat bad food. I had a stressful day today, and I had a piece of lemon cake earlier. That's just what I did. It was in the break room. There was a piece of lemon bundt cake. That was totally delicious. Evelyn's shaking her head because it was. Janessa brought it to work today. It's delicious. I had a piece of that. When we eat foods that are not great for us in our immune system, all right, when we're under stress, and we're more sympathetic, meaning we're fight or flight. And the parasympathetic, as I mentioned a moment ago, is downregulated. No more rest and digest. And we eat food. We don't secrete the same amount of stomach acid. Okay, we just don't. We just don't break down food the way we're supposed to. So we're not going to digest very well. And if we're not eating the healthiest foods, this starts to come together and it starts affecting our gut biome, which is the probiotic status of our intestinal tract. And as our gut biome becomes out of balance, that is another trigger of autoimmunity. Well known. So if our stress response is to eat unhealthy, add that into the equation as well. How do we unravel that? I'm going to tell you the truth. It is the hardest part of my job. People don't always want to share trauma. As a physician, it's really hard to expect that. You should never, as a physician, expect people to just immediately trust you. No, you have to earn this. This is something you earn. Something you earn. So you work to earn the trust of your patient. And then when you have that, now you have to understand and unravel all the sources of trauma and stress and self-silencing in the patient in front of you. And in a very healthy way and supportive way, help create a pathway navigating them back out of that. This can involve therapy. It can involve, with the vagal tone. There's a therapy we do here in the office called stellate ganglion block, where we do an injection into the stellate ganglion with an anesthetic, and it's ultrasound guided injection, and that's been shown to reset that fight or flight, rest and digest. It kind of creates a good balance there. That's a healthy therapy. There's a lot of things we do to help that patient navigate to a better place, but do they all work? No. Are we all ready to take those steps in our lives? No. Sometimes if we tell the patient, you better stop thinking this way, otherwise this is going to get worse. That made it worse, because the one thing you tell someone not to think about, they're going to only think about that, So it's a very dynamic thing, and it's not easy to do lifestyle. It's not easy to sit down with someone and challenge the way they were raised and their culture. And this is what a good wife looks like. This is what a good mom looks like. If you speak up, you're going to be thrown away. If you stand for yourself, the part of you that is upset is not welcome in the relationship. It's hard to tell people. It's hard to confront that. There's so much fear wrapped around that. There's so much cultural conditioning in there. But I'm here to do the hard things with you. This is why I'm not a Disneyland doctor. In all of these episodes and all these podcasts, all I want to do is show you there's a better way of doing it and tell you you deserve it. Any monkey can run a lab on you. Suspect it's that. Run the lab. And then prescribe you what it says in the book to prescribe you. And follow up with you as the insurance policy says to follow up on you. And sometimes that's a good thing to do to stabilize us. True. But that will never, ever, ever be enough. Not while I'm alive. No. We deserve better. We deserve more. And you deserve a doctor willing to do the hard work. It isn't easy. You will go through your life and you will make peace with your self-silencing in the beginning and accept it. You may at some point go to your doctor and they may notice something and they'll run a lab and verify you have an autoimmune condition. They'll prescribe you something to manage it. And you'll start with that. Over time, you may notice your symptoms progress. Dose changes. Doesn't always quite feel right. You may have more side effects from the medication. It's hard to make peace with this protocol that you're under. It's another layer of you just feel like you are long suffering and as nothing is going your way. One more thing going against you. At that point, you may find a doc like me who sits down with you and points this out. That's the big challenge, is to listen to that moment. And then that doctor hopefully opens the door for you and then helps you go through that door to go on a new path. And it's not easy because you're going to start questioning the way that you see yourself, how you behave in situations, how your support system works around you. There's a lot of vulnerability and insecurity that goes into that. Sometimes going against the culture you're raised in really is like you feel like you're going to die because you're being, you're giving up something that's such a core part of you. But still, if you progress forward, you start to learn there's another way. I've seen this work. I have seen women's autoimmune antibodies disappear based upon life choices, based on quitting a job. I've seen autoimmune markers go away. I believe in this. And I believe in you. And I hope this helps. To the degree it does, please, subscribe. And if I did a good job on this episode, you can press like. If you think someone you know would benefit from hearing from this, please share it. If you see this and you think I could do a better job, please tell me. I'm not here for my ego. I'm not here to make myself feel good. I'm here to do good. I'm here to do good. To the degree I did it, I feel like, all right. To the degree that I missed it, give me feedback. I'll do this video as many times as necessary to get the message perfect because it's important. The next one we're going to do is going to be self-silencing and the impact it has on your cardiovascular health because that's critical. It's a big deal. It's a big deal. Thank you so much for tuning in, and I'll see you at the next episode.